Eye color change operations are going viral online. But is this procedure safe? Well, I'm a real doctor, so let's break it down. If you haven't seen these eye color change videos, you are in the minority. They're going viral everywhere, but most of them are from one doctor, and he's a colleague of mine, Dr. Brian Boxer-Wackler. He's a board-certified ophthalmologist in Beverly Hills, and you may have previously seen him on his viral fact or cap videos. Well, now he's gone uber viral with his eye color change videos. Let's see how it works. Well, this procedure is called keratopigmentation. During this procedure, a laser is used to make a channel under the surface of the cornea. And then specialized ink is injected into that channel, instantly changing the color of the eyes. Well, the cornea is colorless, so this adds color to the cornea, making the eye change color. So as you can see, it can be quite dramatic at times. So is it safe? Well, check out this patient who is also a doctor.
Yesterday, I had my eye color changed.
And you're a physician yourself, so...
I am a physician, yes.
So you know all about the inside information on medical procedures.
Yes, it was an amazing experience. This is a very safe procedure. I've read all of the evidence-based medicine out there. There have not been any complications with anyone. But still, you have to follow the directions and lubricate your eyes and take the supplements and do what's required and what's advised by the physician. But the outcome has been amazing, as it has shown in the literature. I'm very excited about it.
So what are the risks of this procedure? Well, in 2024, the American Academy of Ophthalmology issued a warning on the dangers of eye color changing procedures. These procedures are not FDA approved. According to the warning, possible risks include damage to the cornea that can lead to cloudiness, warpage, fluid leakage, and vision loss, light sensitivity, reaction to the dye which can cause inflammation, uveitis, or blood vessel growth into the cornea, bacterial or fungal infection which can produce corneal scarring and vision loss, uneven distribution of the dye, leakage of the dye into the eye, color fading due to the dye moving or leaking into the eye. Don't think that these surgeries carry no risks, says Dr. Joanne A. Giacconi, clinical spokesperson for the American Academy of Ophthalmology. No surgery is free of risk. With purely cosmetic surgeries on the eye is just not worth the risk when it comes to your good vision. That being said, Dr. Boxer-Wackler does have quite a few satisfied clients.
Yesterday, you had your eye color change. What color did you get?
Steel gray, high intensity.
How long have you wanted to do this for?
For over a year. Doing my research until I'll find you.
You wanted to have the high intensity because?
Because it pops. They're popped. I love the color.
How do you feel about it now?
1000% satisfied.
He said 1000% satisfied. Do you like his eyes? Well, how about this guy?
Just got done. What did you think when you first saw your eyes in the mirror?
I was shocked. I couldn't believe that that was myself. I felt like I was reborn. It's an experience that I don't have enough words. It's priceless. This changes my life. It's a whole new person, a new demeanor, it's a new opportunity in life.
So what are some other ways to change the color of your eyes other than colored contact lenses? Well, there are iris implants. These implants are placed through a slit that has been cut on the edge of the cornea. And then the colored iris implant is put into a pocket underneath the cornea and covering the natural iris. Well, Dr. Boxer-Wackler himself isn't a fan of this operation due to the potential complications. And neither is the American Academy of Ophthalmology, who issued a warning at the same time they warned about laser keratopigmentation procedures. According to them, potential complications of cosmetic iris implant surgery include reduced vision or blindness, light sensitivity, elevated pressure inside the eye that can lead to glaucoma, which is a potentially blinding disease, cataract or clouding of the eye's naturally clear lens, injury to the cornea, which is the clear outer area of the eye that focuses light and makes vision possible. If severe enough, a corneal transplant may be needed. inflammation of the iris or areas around it leading to pain, blurred vision, and tearing. And so that's just not so good, is it?
Going with a purple.
You know this is not a naturally occurring eye color.
Yes.
You're good with that.
I do it.
Just made the purple. You know, I think you're gonna really like these. Okay. Ready to see them?
I am.
Purple violet eyes. This has been your dream eye color.
My favorite color since about 13, 14, 15 years old. We'll see how it looks and not just contacts. We're gonna see the real deal now. Here we go. Oh wow. Oh wow, okay. Yes, amazing.
How do you feel seeing your eyes like this now?
Well, dream come true.
So I'm not a fan of these colors because they do obviously look unnatural. But to the doctor's credit, he did warn this gentleman about the unnatural color. Now, the elephant in the room obviously is, what is the risk of blindness with this procedure? Well, a review published in 2025 in the International Journal of Ophthalmology found 0 cases of blindness when keratopigmentation was performed cosmetically. So although ophthalmologists are concerned about risks like blindness, glaucoma, light sensitivity, and vision loss, it doesn't appear to my knowledge that blindness has been documented with keratopigmentation when it's done cosmetically. That being said, it's still a niche procedure, so it's possible that as the numbers of patients undergoing this treatment increase, if they do increase, then we will start seeing people potentially who have blindness as a complication. I need to say that this is different than scleral tattooing, so let's take a look at that procedure.
After you get your eyeballs tattooed, why can't they check the eyeballs at the doctor? The eyeball doctor, I don't know what it's called, but anyways, the reason is because this is called a sclera tattoo. And it covers all the whites. So I had to go into the eyeball doctor to get everything checked before, and it's been about 3 years since I've had my eyeballs tattooed, and it is 100% perfect. I can still see perfect. It's always gonna be like that because I got it done for a pretty expensive amount and from the person that invented it 20 years ago. His name is Luna Cobra. Never messed up anyone's eyes. And yeah, pretty happy with the results.
So he's happy with his result, but unlike what I've talked about on this video so far, scleral tattooing, like what this gentleman had, is not done by an ophthalmologist, but by a body modification artist. This is not someone who's even a physician, much less an ophthalmologist. And unlike cosmetic keratopigmentation done by a real eye doctor, scleral tattooing has had numerous cases of blindness and various states of vision loss after the procedure. So as a physician, my advice is this. If you want to change your eye color, try wearing colored contacts. Any surgery to change your eye color is not FDA approved and it comes with significant risks. But if you still want to have it done knowing that, then make sure you consult with a really experienced board-certified ophthalmologist who does a lot of them. And please do not have it done by anyone else. God only gives you 2 eyes, and as long as they see clearly, is it really that important that they be purple? Well, speaking of body modification, there are people who are doing a lot more than just coloring their eyes. They're splitting tongues, putting holes into the sides of their noses, implanting horns on their heads, and a lot more. I cover all of that in this video right up here. It will blow your mind. And as always, remember to adopt, don't shop, save a life today.